This is part 2 in a video series about practice valuations that I want to kind of make you aware of. And some of these breaking thoughts that I have to do with the fact that in traditional assessment of the value of a dental practice, there are some things that are a little bit hidden that are beyond accounting that I have a concern about, and I want you to spend some time thinking about. And if you're looking at buying a practice, these need to be considered. And so this is Practice Valuation Dilemma Part 2, and this has to do with the periodontal mix of services. The first section had to do with PPOs. This is specifically about periodontal mix of services. So the hygiene department, the business of dental hygiene, is about 1/3 of the revenue of your dental practice. Okay? The periodontal percentage is a very, very critical indicator of how well the dental team is doing for caring for patients with periodontal disease. So what are the statistics? How many adults have periodontal disease? Is it 60%, 70%, whatever? It's giant. Okay, so in theory, that number of patients should be under regular care. And with all the information now we have about the oral systemic connection, there should be a giant number of patients under regular periodontal care, because it is dramatically reducing healthcare costs in the maintenance of their diabetes, coronary artery disease. You know, insurance companies are well aware of the fact that all research is pointing to the fact that patients should be under periodontal maintenance. So this requires an analysis of the codes 4341, 4342, 4910, and 110. Those are the codes that I look at to look and see what percentage there is. So let's look at the level of care. 60% would be high. This would be a very, very good level of care. You have your patients. Your team has your patients engaged in this ongoing process. 40 to 60% would be average, and 30% or lower would be that there's a fair amount of untreated periodontal disease. And I'm going to tell you something. The practices I've looked at, I haven't seen anyone over 30. Okay, this is across the board, very, very low. What does that do with valuation? It has everything to do with valuation, because when you take a percentage and you say a practice is worth X percentage of their growth, I'm telling you that this 1/3 component of the practice can vary from a scale from 10 to 1, and that's huge. So to me, a practice with a valuation that has 60% in this particular category, that's going to be on the higher end of my scale. But since most of the practices I've seen are well below 30, I think they should be dramatically discounted. Now, the other thing that you can look at and you say, well, Dr. Larkin, you know, if there's a high level of untreated disease, there's kind of some potential to unlock there. And I don't disagree with that. I don't disagree with that. But here's what I know. You're going to have to go in there and create systems from scratch, because the systems do not exist. These people have disease, but they're getting routine prophies. So what you're faced with here, without question, is probably replacing personnel. Okay, there are many layers to this onion. It's not a matter of saying, hey, we need to be a little more cognizant of patients who bleed with their prophies, and we need to be doing periodontal treatment. It's not that easy, because this is going to be, you know, it's going to be deep-seated. The problems are going to be deep-seated. And so I think there's a little bit of heartburn involved in a practice. So all I'm telling you is this: between factor 1 and this is factor 2, there's a lot more to appraising a practice than having an accountant crunch the numbers. You have to look at clinical procedures for sure.